So medical data science, it's a really kind of new field, it's a big field. Medical decisions, generally speaking, should be based on data. And of course, as a data scientist, we are uniquely qualified to, in fact, answer questions with data. Of course, medical data science, though, is special in that you actually probably should also be a doctor. I would not want to walk into a situation and, a hospital saying, what should I do? And I'd be like, I don't know. I am not a doctor. But doctors who have data science training are really well positioned to be able to change and make for the better decisions for their patients, for their hospitals, and for society. Typically, what you want to do is link the best available data to an individual patient situation and preferences. This is really what some of these smart systems can do. We talked before about IBM and how IBM tried to launch the Watson system. And basically, it was trying to prescribe and predict what the patient should do. It made some very basic mistakes, though, and it actually wasn't very effective. So what these systems should be doing is really taking a step back and sort of just doing what computer systems do well, which is find patterns. So match the customer's data or the patient's data with the most relevant data that the doctor would need to know, and then connect those things together and then give it to the doctor in an easy to understand format. This will allow the doctor to sort of make the best decisions with the best data possible. They're not missing anything, but they're also maybe being shown something that they already, that they wouldn't have already known. Also, it allows it, when you have a system like this, the doctor is always in the loop, and the doctor is making the decision, not the computer. Data science can, of course, also be used to automate some healthcare processes, especially the things that really don't need to be done by a person. Things like billing, notification, communication, those kinds of things don't have to be done by a person, and they could simply be done electronically. Like, for example, reminders about doctor's appointments, getting a bill, or billing your insurance, or ensuring that you are paying the right amount for a specific service. Those can all be automated and don't actually have to be done by individuals. So, how can data be used in a medical context? Well, should we be giving antibiotics or not? One of the problems that you've probably even seen in your life is that when you go to a doctor and you're sick, they tend to want to prescribe antibiotics. That's not really good because sometimes it can help and sometimes they're actually prescribing you antibiotics when you in fact maybe have a viral infection. And in fact, an antibiotic will not in fact help a viral infection. It in fact won't do anything. It even may make it worse. Over time, as you give more and more antibiotics to people who don't in fact need them, you're creating antibiotic resistance in people, and also you're teaching the bacteria to be more resistant to bacteria over time. This has become a huge medical issue in the world today, and it's something that doctors should be more aware of. Computer systems can be used to basically give doctors a recommendation. Should you give antibiotics, yes or no? Typically, if you choose not to give antibiotics when you should have given antibiotics, it's not that big of a problem because the person will probably get better anyways, just slower. However, if you give antibiotics more than you should, and you do that over a long period of time, you're definitely contributing to a problem. So a computer system could actually be used to improve that. Medical sensors to actually monitor patients can actually be automated. For example, if you wanted to set up an automated system to monitor a baby, and a mother could wear just a device that can actually monitor the baby and use an algorithm to determine the health of the baby without actually a nurse or a doctor being there. This can be effective because, well, nurses and doctors are busy and they have a lot going on. You could also do other things like using health sensors on your watch, for example, like the new Apple Watch allows you to determine what your pulse, it has a pulse oximeter which tells you your blood oxygen level. And it also can tell you, for example, if it thinks you're having a heart attack or if you may have a heart condition. It can actually say, hey, we think you might have a problem. You should probably go talk to a doctor. Also, these data can be used to create personalized treatment plans for individual patients. But of course, it has to be done well and effectively, and doctors, of course, should be in the loop. In the next video, we'll go over smart cities, which is a broader topic and has many different areas to discuss.